Hello, everyone, and welcome to the first episode of Who the Health Cares. Obviously, today with us, we have Dr. Bellavia, who's been practicing medicine for multiple decades. He's really an expert in the field. Today's topic is going to be a pretty broad one, so we're going to be talking about the costs of healthcare and sort of what Dr. Bellavia has seen over the course of his time while being a practitioner of medicine. So the first question we wanted to ask you was, what do you think is the largest contributing factor to the current costs of healthcare?
I think one of the biggest factor causing these high prices in healthcare today is the consolidation and the incorporation of medicine. What's happening now is with the conglomerates of hospital systems taking over the healthcare scenario or health landscape is that they now have become must-have institutions in any health plan insurance company, which means that the insurance company cannot sell insurance to the individuals like your audience without having these large conglomerates in their plan. So when these conglomerates of hospital systems are must-haves, they can demand whatever cost they want. So in the recent years, it's been found that the driving cost of healthcare is that these hospital systems can now demand from health plans, insurance companies, whatever they wish in fees, which makes it impossible to practice medicine in a low-cost model today. Even episodes of programs of the federal government and states and health plans in which you try to save money by reducing unnecessary utilization and waste, it's impossible to do that because at a certain point in time, reducing utilization that's unnecessary will never be enough to match the high cost that hospital systems charge.
Okay, so I guess realistically you're saying not only has it become an issue for patients and their high costs, but even the physicians themselves have been forced into a situation where they're kind of almost forced to charge these prices because they have no other choice?
That's correct. So what happens is the patient is stuck in the middle and is really the victim of all of this because, as we do know, and I don't know the exact numbers, but the highest amount of bankruptcies in the United States of America today are due to patients that cannot pay their health care costs. The second is the fact that these costs are exorbitant. Everybody talks about these very high rates. I can give you an example. My wife recently had some knee surgery. She was in a surgery center for 4 hours. The bill was $25,000.
Wow.
There's an exorbitant fee. There are cases in which you find, due to out-of-network, that the government and the health plans are having to allow these kind of contracts. That I've heard of cardiologists coming to the emergency room and charging $36,000 for a consult that only took 1 hour. And the health plans are now obligated to pay that. And if they don't pay it, then the patient is responsible for paying that exorbitant fee. It's been a long time struggle. They have not come to a resolution on that. But these are the kind of instances that patients don't know about, that they get stuck at the end by the bill, and they get sticker shock. Even I got sticker shock when I got the bill from the surgery center that for 4 hours, and not even that she was there, the operation was only 40 minutes, $25,000. It's an exorbitant amount of fees. And who is going to be able to control that? Is it government? It's not the doctor's fault. He's allowed to charge whatever he wants to do. So it's not a good system right now. It's really a fractured system. There are a couple of other things like that in which they don't allow the access to doctors' offices. They don't compensate physicians, private independent physicians, enough in reimbursement, so they can't supply the care that's needed. So patients will go to an emergency room where their bill will be enormous compared to if they went to a doctor's office where it'd be a whole lot less. The other factor is in some independent hospitals, it's certainly you can get care, good quality care, at 5 times less than a hospital that's in a hospital conglomerate in the state. You can get outpatient services, for instance. If you go to independent places outside of a hospital system, you can get an MRI for $300. If you go to a hospital, that bill is $3,000. So sooner or later, the patients have to be educated as to where they can go and get the care in an independent, competitive neighborhood of healthcare.
All right, great. So, I mean, would you say that maybe potentially a problem is that patients are just completely unaware that there are these other options that are available? I mean, you said yourself you could go for one place, pay $3,000.
I think
Go to another place.
this is a big fault in the fact that patients are not aware. I remember that years ago in buying insurance, that the government felt that the individual person was not intelligent enough to buy his own insurance, and so you had to get your insurance through your employer. So whatever the employer wanted to get for you is what you got. If we don't include the patient in the three-legged stool, that's the hospital, the physician, and the patient, to understand what's going on and his options of where you can get good quality care at a lower price. And that's where I think that the competition has to come back into healthcare. In this town, for instance, there's a doctor down the street. He is going to get the same reimbursement that I get, and I may be giving a lot better care than he is. But it makes no difference. But if we were in real competition, maybe patients would pay a few extra dollars for quality rather than going to just anybody. If we don't put the patient back in the equation, it's never going to be resolved.
Okay, yeah. So, I mean, how do you see that working out in the future? So, what's the solution to sort of breaking up these huge conglomerates?
Well, I think that is only going to have to be at the level of government. And we're going to have politicians step up to the plate to resolve this problem once and for all. So the root cause of all of these healthcare problems really lies in our legislature, who fails to legislate the things that are necessary. So if the patient is not aware of these items, and let's face it, you buy insurance from a health plan, you get this big booklet. I can tell you that most patients don't read that booklet at all. So everything is now a surprise. And as physicians, we hear, well, I pay so much money for my insurance, you mean it's not covered? So maybe there has to be a better way of educating the people to do this. Maybe it'd be better if, instead of buying insurance in that kind of sense, is to give each patient a credit card with X dollars for healthcare, and they could go out and buy their healthcare where they think it's appropriate for them at the best possible place. And if that happens, you'll bring back competition amongst the physicians to strive to get much better care. But when somebody else is paying your bill, you don't have any say in the matter. So one of the ways is to include the patient by giving him an allotment of a certain amount of money, whatever that amounts to be, and this is it. Now, everything is covered. Everything is covered. Now, that's not catastrophic stuff. That's not counting, hospitals for operations and things like that. That's high-cost medicine, and they should be able to take out of that money that's given to them each month to buy a catastrophic secondary insurance to cover those eventualities. But for the common everyday stuff that's going on, they should be able to learn to get their care at the best possible place that they can find at the cheapest possible price that they can afford, instead of one size fits all for everybody.
That's a really interesting plan. I don't think that very many people would have suggested something like that, especially with sort of the rising popularity with things like single-payer healthcare, right, or the exact opposite in completely free market.
So if you have single-payer healthcare, my concern on single-payer healthcare is that your healthcare is going to be rationed. It's just definitely going to be rationed. And there's a big difference in healthcare from what the patient wants and what the patient really needs. So every fall and a scraped knee doesn't need an MRI of the knee. But the patients want it. In today's world, they usually get what they want because somebody else is paying for it. And when you're sick, you don't care how much it costs. Whatever it costs, please get it for me so I get well. Then when it comes time to pay, oh, who told you to do that? So it's very complicated. What I'm talking about is a very simplistic analysis of a really great problem.
Understood. Yeah, and I think so. Another thing that you were kind of touching on a bit as well was this sort of incentive for physicians as well. So you've said before that if you've created a system where these huge conglomerates are determining really everything, what's the incentive for a physician to go above and beyond for a patient when kind of doesn't matter what they do as long as they follow the sort of basic guidelines?
So if I in my office practice good quality medicine with a patient that understands, gets what he needs, because I'll never want to deny a patient anything that they need medically. In fact, I tell my patients, listen, if I think that the best care you can get is in Moscow, I'll tell you to go to Moscow and get it. But let's be realistic of what's going on here. I could do all I can to have and help for utilization and lower cost. Once they leave my office, they go to the hospital conglomerate where the charges become enormous. So no matter how much the physician tries to reduce utilization, unnecessary utilization, always unnecessary utilization, we can never make up the high cost that's being charged elsewhere. It's an impossible situation. So what happens? How did the hospital conglomerates get together? So they promised government that, well, we get together, we're going to have economies of scale and we're going to save money. And besides that, we're going to give everybody a higher quality of care, a greater outcomes. Well, even though all the literature at that time was against that, that said that's not going to happen, you're not going to get reductions in cost, you're not going to get reductions in utilization, and you're not going to get higher outcomes and better outcomes for your patients, it's going to be the exact opposite. They still went ahead and approved all these conglomerates joining together. What do we have today? Exactly that. They have failed to reduce the cost of healthcare, and they have failed to improve the status of the healthcare of our country. In fact, they have done the exact opposite. It's costing a whole hell of a lot more money, and the quality of the care has certainly reduced. And I'll bet that you could ask anybody in your audience that that's what they're experiencing in hospitals today.
So, would you say that that's really more a result of, let's say, ethics, or companies caring more about their shareholders as opposed to like the patients that they're caring for?
I think you hit it right on the button. I think that why do hospitals spend so much money in advertising? I mean, you can't look at television, you can't listen to the radio without some hospital system advertising that they're the best in the country. Whether it's U.S. News and World Report, you see it plastered. Advertising in healthcare is enormous. And healthcare is a local business unless you have a very serious problem where there are central located places. Okay? So the point here is this. If they were to spend 1/10 of their budget for advertising and devote that to actual delivery of healthcare, we'd all be better off. Okay? But all these hospital conglomerates, they only have one thing in mind right now, and it's unfortunate, I think, that it's the bottom line. I recall a hospital system that would talk about, well, we're at the $1 billion mark, and we talk about quality and caring of patients. We got to the $1.5 billion mark, and we still talked about quality and care. Then they struggled for the $2 billion mark. When they got to $2 billion mark, guess what happens? It's no more compassion and quality care. It's corporate medicine. How are we going to get to $3 billion in care? And at that point in time, and I think what happens when they buy these physicians, they lose money on every practice they buy, but they don't care, because now they captured the market on all the referrals to that hospital and forced those patients, those doctors that they bought, to refer to those doctors in that hospital system. So the competition is no longer there. These doctors are now, the question that patients have to ask to a doctor that's bought by a hospital system, are you really thinking about my health care, or are you worrying about your job and the bottom line of your employer? And it's a very serious question that people have to start to ask today. And by the way, if you look for access in these conglomerates on the specialist side, it's very hard to get. The availability of the specialists in hospital systems is very hard to get into a doctor's office in a reasonable amount of time. And I can tell as a primary care physician, when I do send patients to those doctors, it's 4 weeks, 5 weeks, 6 weeks wait. Unless I call up specifically to that doctor and ask him to kindly see a patient who's in pain and can't wait 4 or 5 weeks to see him. Or they drive them into the emergency room. Right? Going to the emergency room just increases the cost of care. Just increases the cost of care. And the patient is the victim. He has nowhere to go. He's locked into the system and can't do anything. So I think it's going to be incumbent upon politicians and legislatures in each state to really take a strong look at how healthcare should be delivered and sit down and devise a program where it'll be worthwhile for patients to get the better outcomes at a much lower cost. If they don't do that, I'm afraid that the cost of healthcare will skyrocket so high that it will actually damage the United States of America. As it is now, it's 20% of the gross national product, and still growing.
Wow. Yeah. So I mean, that sounds really daunting. I think for most people,
it's a big problem. It's certainly a big problem. I think that most politicians don't want to touch healthcare. And I can understand why. Most patients don't want anybody interfering with their health care. They're afraid that if the legislature gets involved in their health care, that they may lose it in some manner or fashion. So the legislators and the politicians of today have to promise the public that, look, anything we do for you is going to be worthwhile, not to be in the pocket of these hospital conglomerates and into these lobbyists. That the healthcare industry has the most lobbyists than any other industry in the United States of America. And there's a reason for that. And it's all dollars.
Wow. Yes.
And by the way, dollars don't buy you good quality healthcare. As I don't know exactly, but I think that the United States probably spends the most per capita in healthcare and is about 37th in the world in the quality. So spending a lot of money on it doesn't mean that you're going to get top quality healthcare. You're going to get a lot of waste is what you're going to get.
Yeah, well, so I guess that's sort of the system that you're talking about. Is it's a system of waste and profit rather than quality care and satisfaction with patients.
Exactly.
So I mean, do you think that is there a way in which we could sort of separate the politics from healthcare? I know you were talking about there are so many lobbyists. Well, what if there weren't?
In today's world, it's very difficult to separate politics from healthcare. It would be ideal if you can do that. I've always had the feeling that politics should not enter into healthcare. And politics doesn't make a difference if you're a Republican, Democrat, Independent. If you're going to get healthcare, you should get the best quality healthcare there is available. And not because somebody's made a special deal somewhere to get healthcare or for that system or physician group to get more money than others. Okay? So it's not a fair system. The public is the victim. Patients who are not getting the quality of health care that they're supposed to be getting today, or are being touted that they're getting, but they're not getting. I'll go to another state. You take the indigent people in every state, the Medicaid systems, okay? The Medicaid system is the biggest rationing of healthcare in the country. These poor people are promised healthcare. The amount of reimbursement that these people want to get to pay for their health care is so minimal that it's practically is not giving them anything. It's just politicians and other people saying, look what I gave you health care. That health care is practically worthless to them. And besides the fact, not only is it worthless to them, the government who's paying that bill wants that bill to be so much less that they ration the care and they make it difficult for the patients to get that care and make it even more difficult for physicians to supply that care. So what are these indigent people getting? They're getting a snow job. I'm going to give you insurance. If the insurance is there and you can't get anything out of it, what good is it? Does the state realize that they're throwing money away in a situation like that? Wouldn't it be better to pay $10 more and make sure that these people get the quality of health care that they need? And so down the road a piece, it doesn't cost the government a ton of money to take care of the things that they were not able to take care of because they couldn't get it. It's a situation where politicians and legislatures have to really sit down, take their heads out of the sand, and face the problems, face them head on, and get the things. And I would hope that the American people would have a revolution for healthcare and say, hey, you guys are not giving me what I really need. I'm not saying you have to give it for nothing, or that should be socialized medicine. But I think there's got to be a better way of delivering healthcare than there is today.
Yeah, definitely. I think most people would agree with you. I know we've talked to many people that have been, dissatisfied with the care that they've got. If only again, with Medicaid services, even just being able to find a doctor that'll accept that insurance can be difficult.
I see it every day. Every day patients are suffering, getting sicker because of the bureaucratic issues involved in the delivery of healthcare to patients today. And it's all based upon that bottom line. And I can firmly believe that done right, with compassion and caring, and not caring and just throwing more money at it, the people will be much better off. But again, we can't do anything about it. This is all got to be in the hands, the root causes in the hands of our legislature and the laws and the regulations that they put in front of the people.
Understood. So yeah, I think, a big thing that you're getting at is sort of the government has constantly been sort of actively giving out these short-term sort of bandages rather than like a long-term solution.
Exactly.
And what you're getting is patients are having poor care, which equals them eventually ending up in the hospital where they have those high costs, which in many cases can bankrupt patients.
I would also make a claim, and I can't prove it yet, but I would bet that in all the plans that CMS has put forth to the healthcare industry in an effort to utilize healthcare better, save money, and give it better outcomes, have been failures. I think that the amount of money that the government says that they saved in all of these gain-sharing programs that they've had in reimbursement programs, I would hope that somebody could take a look at these numbers. This is just my thought that it may be that it's a rounding error, the amount of savings that they've accrued in these times of these programs as to what they thought they would get in the amount of money. So the amount of money that they saved is probably just a rounding error compared to the entire budget of healthcare. I think it has improved the quality of care in some of these patients, but it's certainly not been enough. And the testament to that is that the federal government keeps changing these plans. They keep changing the plans. So if you've got a good plan that's working really well, why haven't we stuck with it? Yeah. And every day you get different 3 letters are out, this program, that program, this program by the federal government, and they all sunset out. And I think if somebody had the time, and I don't certainly have the time, to take a deep dive into what the actual cost savings has been for this country, I think they're going to find out that it's a rounding error against the total cost of healthcare in the United States. But that's just that's my thought. I can't prove it.
Yeah, of course. So do you
I'd
think
love somebody to do that, though?
Yeah, I mean, it sounds like it'd be beneficial for like some sort of third party or independent to like actually do that analysis to assess whether or not like is our government actually doing what they're saying they're doing? Are these services actually working? And if they're not, like let's actually change them to something that
I
is
think
helpful.
they need the words truth and transparency. And if it's a fact that they sunsetted all these programs, why did they sunset it? Was it not working? Then you have to admit that it wasn't working. Okay? And then be honest with the people and say, hey, look, we tried, this didn't work. Let's try something else. Okay? And the problem, I think, a lot of in these cases, you get a lot of bureaucrats and people who sit in white towers trying to make decisions and try to usurp the relationship between the doctor and the patient in the examining room and telling us that you can't do this, even though it may be the best thing for the patient. Okay? So I'm not saying that every doctor is a great doctor and does this well, but the problem has to be looked at, I think, through different lenses now.
Certainly. So, I mean, you've kind of talked a lot about these sort of like more grandiose solutions. Are there any sort of like more immediate short-term things that can maybe alleviate some of the symptoms of the current sort of woes of healthcare? So like I think a big one that a lot of people talk about is even just price transparency, like you were saying before, allowing patients to see these different options.
Look at it this way. You know, when President Trump was president, he tried to put through a law called transparency, right? And he said, I want all hospitals to post their fees so that the patients can see exactly what the costs are in that hospital, right? Have you seen that? Have you gone to a hospital and see their fees exposed? Have you gone to their website and find it easily where those costs are posted? This is a federal law, right? So if you had to spend the money and you go to hospital X and you see that they're charging $25 for a Tylenol pill, would you be upset?
Yeah, I think everyone would be.
Okay. Or if you go to another hospital in the same community or nearby and they're charging $5 per Tylenol. Hey, if it's your money, you out of your pocket, and you want to spend the $25, God bless you, go ahead and do it. But most people would be able to say, well, maybe if I go to the hospital with the Tylenol is $5 instead of $25, I can possibly get the same care, the same quality of care. Okay? And it'll cost me less money. Because eventually that patient's going to have to pay one way or the other. So the transparency rule is a law. You try and find it. Try and find it. So what the president tried to do at that time is to stir competition amongst the hospital systems. And they just ignored it. Nobody's done anything about it. Nobody's saying, hey, where did you post it? Right? Have you seen doctors post their fees anywhere or on their websites? They just disregarded the rule altogether. So, truth and transparency. Right? I'll give you another instance. Medicare Advantage is another issue, which they're taking advantage of the seniors. So, theoretically, Medicare says to an insurance company, I'll pay you 95% of all the money I spend on this group of patients, right? So the government says, that's great. I know my cost now. My cost is 95 cents on a dollar for these people. And the healthcare plan says, okay, I'll take it $95. And the rule was supposed to be that you take it for $95 and you have to give the same things to the patient, that you can't deny them anything. If Medicare was allowed to give it to them as a covered service, it has to be a covered service, right? Well, guess what these health plans are doing? They're not doing that. A lot of these health plans are saying, no, that's not covered. Or the reimbursement for that issue. I'll give you just a simple example. A $15 fee, one insurance company where Medicare would pay $12 on that, which is the 80%. The Medicare Advantage company pays the doctor only $3. Hey, is it going to be worthwhile for that doctor to do it for $3? Probably costing him more money than $3 to do that for the patient. So what happens? The patient doesn't get that care. We can't expect the doctor himself to subsidize the health care for the population. So the Medicare Advantage is also taking advantage of the senior citizens. And I'm going to bet that they're wasting the money today that was going to be there for the senior citizens tomorrow is not going to be there. And it falls on deaf ears. Falls on deaf ears. Anytime you talk to government, anytime you talk to these people, they don't want to hear that. Okay? It's a big money maker for these and the hospitals and so on. So all of these issues, they fit into this big bundle of problems, but nobody takes them out and takes each individual one under a microscope and see how they can fix the problem. And we just keep going on, the same thing, spending more money, not getting the quality care that we have in healthcare, and so on. So it's horrible.
So from a political standpoint, would you say that this is a matter of just like politicians that are sort of in the pockets of these conglomerates, or is it a matter of, well, they just don't care? Or,
well, I don't want to go out and accuse people like that publicly, but I would venture a guess, if one would take a look, that you will see that the donations by hospitals to politicians is very high. You'll also see that donations by health plans is very high to politicians. So I wouldn't say they're in the pocket of, I don't want to go that far, but I'm sure that the politicians are influenced. I think another thing, more importantly, that politicians are influenced in is that they don't want to mess with somebody's health care. Okay? And if people think that as a politician I'm messing with your health care and I may be doing something to take it away, they won't be reelected. So they're not honest enough to say, let me take a good look at the problem. Maybe we can do something for you. Instead of saying, well, healthcare is not my problem. I'm going to look into the armed forces, or I'm looking into farm issues and other things other than healthcare. And they're also afraid of that patient who's on a stretcher, like all of us. If you're in a hospital on a stretcher and it's in critical condition, you want everything for yourself, right? You don't want to worry about it. Who's going to pay for it? Is it going to be paid for or not? So you're on that table and you have healthcare, and you got to worry about a politician is going to do something to take away that opportunity for you. And that's what politicians, I think, are afraid of. It's a real problem. I think if they would get the right people in a room, they could probably sort this out. It's not an easy problem. I'm not saying that it's an easy problem. But I think they have to look at healthcare under a different lens now, and a lens that will actually bring the quality of care that the Americans deserve for the amount of dollars that are spent for it. And I think another issue, when you take a look at most hospital systems, look at the salaries and the preponderance of executives in all these hospital conglomerates. I mean, you're talking about 7-digit figures for people and a whole array of one executive laid upon another. And I would say, if you can cut that down by 50%, add that to the that money to the delivery of healthcare to people. Take down the cost of all this advertising that they do to the delivery of healthcare. So it's a very complex problem, and I'm not trying to point fingers at anybody. What I'm trying to say is that the healthcare industry has not played the truth and transparency with the American public to actually deal with the issues of healthcare and its delivery. And if they did, they can come to a solution.
Yeah, I mean, it's certainly. I mean, I know you said that it's a very complex issue, but it seems to me like really what you're saying is that if we can get rid of all of the sort of the waste and the inefficiencies and allow patients to make informed decisions for themselves, that'll.
I'll also make another prediction. If we can get rid of the waste alone, everybody could have healthcare for free.
Wow.
Just by getting rid of the bureaucracy and the waste in the system, I would venture a guess that most of healthcare could be free, using the same dollars as you have today. Or everybody could have a good insurance policy.
Yeah, I mean, that would certainly be nice.
Not only that, if we reduce the cost of healthcare, it could put American industry back in competition in the world stage. Got to remember that a lot of this healthcare cost is paying by your employer. That cost goes against their bottom line that they can't compete in the world stage. So if you're looking to actually save the country in its economic woes, they've got to take a look at healthcare. When a certain industry is 20% of your GDP, you've got to take a look at that. Not only on the basis of delivery of healthcare, but where this nation stands in the world markets and how our companies can even compete in the world markets when they have this high cost of healthcare that for most people today are going to say it's not even that great.
So you sort of brought up an interesting point while you were saying that. Are you maybe even suggesting that healthcare shouldn't necessarily be tied to employment, or do you think that overall is like an okay system?
I don't think it should be tied to employment. I think people are mobile, they can move around, but here's the problem. If your employer is paying that fee, right? Doesn't he have the right to say if you leave his company and employee, why should he continue to pay for it? Right? What I'm saying is if you can reduce the cost of healthcare, and you could have a policy that's paid for out of that savings and that waste, you can go anywhere you want in the country. It's not dependent upon your employer anymore. Besides the fact, you can buy a policy that's adaptable and specific for you rather than one policy for everybody in that company. And why don't they segment it out? Segment it out by age. Why do some employers pay for birth control for their female patients and others don't? It's a cost factor. So it's not always the insurance company that's to blame for non-covered services. It's the person buying that insurance and saying, for this amount of money, I have to cut something out. I'm going to cut this out, this out, and this out. It's not the insurance company making that decision. It's actually your employer. So if you had a policy, you had enough money to take care of your everyday needs, not your catastrophic stuff, okay? How much money does a woman need in a year's time healthy and stay healthy? If she's in the age group, she goes and gets a mammogram every year, right? She gets a physical once a year, gets a blood test once a year. How much could all that cost? $500? And how much does that person pay? At least $1,000 a month in insurance, right? So if you bought an insurance policy at a lesser premium, because that's all you really need, we'd all be better off. But you can't do that because your employer's got to buy for all his employees, right? And why don't we take the people who don't take care of themselves, pay a higher premium, instead of because of their negligence in taking care of themselves, having the rates higher for everybody. I have a pet peeve on smokers, right? Smokers, to me, should be paying a higher premium for their health care costs because they're going to need a lot more health care costs. And therefore, if they want the privilege and the happiness of smoking and getting diseases, then they should be able to pay for it. Why should the guy who doesn't smoke, takes care of himself, pay a high price of insurance to cover the cost of this pellet? To me, it only makes sense.
Yeah, it seems like a logical conclusion, and even you can create a system to maybe incentivize those who are practicing sort of poor health to change how they view their health, so that they can even save money. So if you have a smoker who quits smoking over a long period of time, their healthcare plan changes. Right. It becomes cheaper because that's no longer a factor.
So you talk about these value-based programs. So the concept is to get the people well, right? Keep them well in advance. What I say is let's not move them to the right. To the right is disease. So if we keep them well here and keep them far from the right side of the equation where they're sick and require a lot of cash to take care of them, spend the money here. Let's slow this rate till they get to this illness and stuff, okay? So if you do that, you're going to save a lot of money down the road a piece. So why not spend the extra money on wellness? So here's what happens to you. You go to a doctor, you say to the doctor, well, if you get good quality scores and it doesn't cost that much money, you'll get rewarded for it. But if you're going to keep somebody healthy, it's going to cost money to do that. So you're in a bind. You're in a catch-22. If I spend more money to keep you well, then I get penalized on the savings. So it doesn't always work that way. So either you want good quality care and people healthy, you're going to have to pay a little bit more for that. And of course, if we keep them happy, the savings comes later. But if you're an insurance company and you're paying for somebody today, and let's say 2 years from now they spent all the money to keep you well, and you change insurance companies, so the next insurance company gets all the benefits of what they pay for, and they lose out. So how do you fix that? Again, give the cash to the individual patient, instruct them how to do this, give them the instructions of how enter in, and put the doctors back in a competitive mode. When I started in healthcare years ago, it was a competitive market. You either had to be a good doctor or people didn't. They walked with their feet. You weren't a good doctor. And how many people would like to pay a couple of extra bucks to go to a very good doctor rather than a run-of-the-mill guy that's just in the program? I think people buy quality. And that will force each doctor to do a better job.
And get rewarded
and
for
get
it.
Rewarded
too.
for it.
Yeah.
A lot of this is common sense, and I simplified a lot of it. It's a lot more complicated than that. But the problem I have is they're not doing anything about it. They're just throwing good money after bad, another program with 3 or 4 letters attached to it, 3-year project in only a few states. Healthcare is a local business, folks. Local business. What happens here in Hasbrook Heights makes no difference what's happening in Bismarck, Nebraska, for instance. Okay? So you got to take into consideration the geography, right? And so on. It's a big task, and it will take a couple of years of intense working on it and trying it out. But again, you got to take the politics out of it. And whose pocketbook is going to be hurt if we do fix the healthcare system? And how's that fight going to happen? How's that fight going to happen? It's just common sense stuff, folks. It's not rocket science, I don't think. Not rocket science. When I started out in practice, an office visit was $5. Okay? And insurance was different. So if you had insurance, it didn't cover office visits. You had to pay the $5. And if you wanted blood tests, they would only pay for a certain amount of that blood test. They would give you like an X dollar amount for blood tests and x-rays. Okay? So you went to the doctor, you were prepared that you had to pay for it. And it was a reasonable fee. And then after the Korean War, I think it just exploded with this insurances and covering this and covering that, made it a mishmash. And the other thing is you could look up, there's a study out that says any state in the union that has a preponderance of primary care physicians over specialists gets 2 things: better quality outcomes at a lesser cost. As you increase the amount of specialists to primary cares in that state, the quality goes down and the costs go up. Very simple fact. So why doesn't the government do something about preserving the independent primary care practice? Because that's where the real value in healthcare is. Okay? The doctor is not committed to the corporate structure of healthcare and making his boss and his corporation and his stockholders wealthy, but actually taking care of the patient and his own private business. Now, these are questions that have to be answered in an open forum. And people had, and not only me, but the regular public has to ask those questions. How about people that come into our office and they need something, and the first question out of their mouth is that covered by my insurance? Is that doctor in my plan? All of a sudden, got to realize that the cost of health care to each patient is important. And they're almost willing to forego some care, right? Because of the cost. How about with the new deductibles, high deductibles they have under the Obamacare? You want to go get a colonoscopy and you're 50 years old, and you got to put $3,000 out to have it done. You're not doing it. You're not doing it. So, in 2 years you get colon cancer. Now it's costing the system tons of money. But you raise those deductibles, and people are having a hard time putting food on the table today. Inflation is coming. How many times do we hear that people have to put off medicine to get food? Or they're putting off medicine and healthcare because they got to pay the rent? Whose fault is that? It's your legislature's fault. Because they're not passing the right laws to make it happy for all of us. So it's a major problem, the healthcare cost in this country. It's not an easy problem to do. I would love to see some honest politicians, if we can say that, right? I'm not to actually address this issue for the simple thing of saving the country in healthcare cost, saving the industry in our country, and reducing their GDP and getting better quality. But so far, every politician I've spoken to has not listened at all.
Yeah. Well, I mean, I guess, like you said, it's fairly difficult if they're effectively in a lose-lose situation. Maybe they agree with you.
They are in a lose-lose situation.
As soon as they mention it, it gets shut down immediately, or they risk not being reelected to actually implement those things.
Yeah. It's the same. Well, I don't want to get into the politics, but it's the same reason why you're not going to shut down Twitter and Facebook and so on. They pay too much to politicians, donations, and therefore you're not going to change anything. And by the way, you like Facebook. Well, I mean you personally, but people generally like Facebook. Their friends like Twitter, and they won't give it up. But in any case, for healthcare costs, these are major concerns. There is a lack of access to healthcare today because of finances. There's even a lack of ability with the young doctors coming out, not being trained to the point of being actually clinicians. They're just textbook guys, throw a test against the wall, see what sticks. And there's no longer any compassion because they don't have to be. They get their paycheck and they go home. I'll give you a classic example. Before I was drafted during Vietnam, I was in practice. I worked hard, worked 10 hours a day, whatever it was. The more I worked, the more money I earned. When I went into the Army, if I worked 100 hours a week or 3 hours a week, I got the same paycheck. So I will tell you, in the Army, at 5 o'clock every day, the doctors walked out because they were finished. That was their shift. We didn't bring home any problems. We didn't bring home, any phone calls. We went home. I didn't have to worry about the patient anymore. And this is exactly what's happening to the doctors that are being bought by hospitals today. You work enough hours to cover your pay, you don't have to care about anything else. Try it. Patients, make a phone call to a hospital-owned specialty practice and see how soon you can get an appointment for anything. Test it yourself. See what it's like. Because if I'm not getting paid a penny more to stay after 5 o'clock, I'm out of here. And then I got to fight for every dollar that with the bureaucracy and the rules and regulations that are going on. And the fact of the matter is that the government has interfered in the patient-doctor relationship. And you buy the insurance, and that's what you got to go by. So anyway, the country's got a long way to go. I'm an optimist. I think it could be resolved if people and certain lawmakers would actually sit down and address the actual issues at hand here, and not just listen to the bureaucrats in white towers that haven't practiced medicine at all, have not had that interaction between patients and doctors or nurses and so on, and see what's going on. And it can be corrected. There's no doubt in my mind. If there's a will, I think there's a way. I hope that answers your question briefly on healthcare costs. There's a lot more to it. We can go on and on, but maybe in the next session we could do some more.
All right. Well, thank you very much, Dr.
Thank you.
Bellavia.